Hi, my name is Zachary Rawluk, and today I'm going to be demonstrating how to change a chest tube dressing. So first, I've already checked the physician's order, and a dressing change is due for this patient at some point today, so I'm going to do it now. I've already entered the patient's room with all my supplies I've gathered from the supply closet, and I have already explained the procedure to the patient, so I told them that I'm going to be removing the gauze and the Jelonet and the Me-Fix, and I'm going to be cleansing the site with normal saline, drying it off and putting a fresh new dressing on top of it. He's consented to the procedure, he understands the benefits and the risks of it. And I've identified the patient using 2 patient identifiers with his armband, and he's verbally responded to them and confirmed them. Okay, so first I will perform hand hygiene. I will raise my side table to waist level to promote sterility. I've raised the patient's bed level, and I will raise his head of the bed to semi-Fowler's position so I can get a good plain view and good access to the dressing. Okay, so now that I have all my supplies, I am ready to go. So first I will set up my tray here and create a nice space. Grabbing my blue forceps. Now some of it's hanging off, so at that edge, within that is going to be, with 1 inch within this border here is going to be my 1 inch border. So then I can grab my drape, discard that, I won't need it. And I can grab my garbage bag here. I'm going to be using it at the patient's bedside. Put it between their legs. Okay, and then I can set up my forceps. Using a tip-to-tip technique. Perfect. Set those down. Now I can add some items to my tray. So I need a gauze sponge. You'll notice there's some Jelonet that stained my tray on previous attempts, so we can disregard that. And add my 4x4 gauze. Good. Add my Jelonet that I will be using. I can add that to my tray. Good. Okay, and then finally, add some normal saline. The bottle's not expired, it's intact. It's a fresh bottle, so I can use it here, add it to my tray. Good. That off to the side. Okay, now at this point, I've set up my sterile field with all my items that I need. So now I can start to remove the dressing. Just need to put on some clean gloves. Start at the edge of the dressing, making sure to keep the tubing stabilized. It is sutured in, but we want to make sure not to manipulate the tube as much as we need to. Okay, perfect. And we can inspect the dressing to make sure that there's no drainage, there's no purulent drainage at all. So then that's good, the site is dry and intact. Okay, and then we can remove the Jelonet using our blue forceps. no drainage on that as well. We can discard these forceps because they've been contaminated, so I put that in the sharps bin. Okay, I remove my gloves. Perform hand hygiene. Now I can inspect the site. There's no emphysema, no erythema, there's no redness, the sutures are intact, the tube is intact, there's no signs of air leak, and it's a very healthy and intact site. Okay, so then we can begin in actually cleansing the site. Dab it in some normal saline, get rid of that excess fluid. Start from the innermost portion, being careful not to touch the forceps to the skin or the tube. Create very nice rosettes here. Good. Start a little bit more outer now. Good. Make sure you get all the way around. Probably just need one more swipe around there. Good. Now we can cleanse the tubing itself. Starting from the top portion. And then the bottom portion. Good. And we can dry the site using some big 4x4 gauze that we have here. Starting from our innermost portion. Again, making sure that the forceps don't touch the tubing at all. And then the most outer portion here. Good. And we can dry the tubing itself. Starting from the top. And then the bottom. Good. Okay, now that we've done that, we can place our Jelonet. Okay. And then we twist it. Like so. Making sure it's secure. To the site to protect detect any potential air leak. Very good. Then we'll add our gauze sponges. Making sure they're in different directions. And finally, we can add our 4x4 gauze. Over top. And I can put these in the sharps bin. Don't need them anymore. We're done with our sterile field here. We just have 2 pieces of meat fix that we will secure. So you kind of stretch it apart, like so. Secure it to one side. Pull the other part. And you can actually tent the me-fix there to add some extra securement of the tubing so it's not moving around quite as much. We can add the other piece here. You want a nice tight seal to almost kind of create pressure so that it stays secure to the skin. So we're kind of holding everything in place nicely. Good, and then at this point what you can do is write directly on the dressing when it was done, the date and time, and then my signature. And then I can document that the dressing change was done in the physician's, in the EPR, and then come back later to make sure that the patient's still okay. Thanks.